Here we need to discuss about the diastolic blood pressure. The diastolic blood pressure correlates with the volume of the blood which is present in the aorta during diastolic period of the cardiac cycle. For example, to understand the diastolic blood pressure, you need to know the mechanism behind it. If you see the anatomy of the heart here, this is the left ventricle and this is the right ventricle, and we know that the exit channel from the left ventricle is the aorta, and the cardiac cycle has been divided totally into 8 phases. Systole, that is isometric contraction, rapid ejection and reduced ejection. And if we talk about the diastolic period of the cardiac cycle, after the systolic period there is a diastolic period of the cardiac cycle. We have 5 events in this. One is the protodiastole, protodiastole. After that we have isometric relaxation, rapid filling, reduced filling and atrial systole. These are the total 5 phases of the cardiac cycle. So what happens during the systolic period of the cardiac cycle is, that is especially during the ejection period, the blood is ejected from the left ventricle into the aorta, right? So the total amount of the blood which is present in the left ventricle after atrial systole, that is after the end of diastole, is 130 ml. This 130 ml is present after the atrial systole, that is the final phase of the ventricular diastole. That is the reason we are calling this as the end diastolic volume. And out of this end diastolic volume is 70 ml is ejected into the aorta, that is 70 ml out of 130 ml. This is called as ejection fraction and this is called as the stroke volume, right? So once the blood is pumped into the aorta, that is after the rapid ejection as well as reduced ejection, what happens is the diastolic period begins. The first phase of the diastole, that is ventricular diastole, is a protodiastole. So once the blood is in the aorta, once the reduced ejection phase is completed, what happens is the pressure in the ventricle slightly drops, that is responsible for the closure of the aortic valve, that is closure of the semilunar valves. Once the semilunar valves are closed, because of the gravity, what happens is some amount of the blood remains in the aorta. So the amount of the blood which remains in the aorta after the systolic period, that is during the diastolic period of the cardiac cycle, creates a pressure in the aorta called as the diastolic pressure, and this is called as diastolic BP. That is the reason I said that the diastolic blood pressure correlates with the volume of the blood in the aorta during diastole, that is from the protodiastole to the atrial systole. This is what actually creates the diastolic blood pressure. So what are the factors which affects the diastolic blood pressure, or what are the dependent events of the diastolic blood pressure? It primarily depends on the state of contraction, that is tonicity of the peripheral resistant arterioles, tonicity in the peripheral resistant arterioles, and also it depends upon the viscosity of the blood, and also it depends upon the heart rate. There are so many factors which are responsible for the amount of the blood which is present in the aorta as well as the pressure inside the aorta during diastole. So what are the causes which increases diastolic blood pressure. This is what is important for you to know as an MCQ point. First, vasoconstriction of the peripheral arteriole. So, what are the causes which are responsible for the increase in the diastolic blood pressure? So, increase in the diastolic BP. Increase in the diastolic BP is seen in a condition where there is vasoconstriction of arterioles. Vasoconstriction of arterioles, that is peripheral vascular resistant arterioles, right? So, a greater the volume of blood is present in the artery while the heart is filling up in the diastole. And second important factor which increases the diastolic blood pressure is increase in the blood viscosity. That is hyperviscosity blood in conditions like polycythemia. In anemia, the viscosity of the blood is decreased, but in polycythemia, the viscosity of the blood is increased. So, increase in the blood viscosity, right? So, vasoconstriction of PVR arterioles increases diastolic blood pressure. Increase in the blood viscosity increases the diastolic blood pressure, as well as the third important factor is increase in the heart rate. Increase in the heart rate, remember that, decreases the filling of the coronary arteries, leaving greater volume of the blood which is present in the aorta during diastole. What is the meaning of this? We know this, we have the left coronary artery as well as right coronary artery. And these coronary arteries receives its blood supply to the myocardium during diastolic period of the cardiac cycle. If the diastolic period is actually 0.53 and 0.27 seconds is the systole, 5.3 is the diastole, 0.80 is the cardiac cycle when the heart rate is 72 beats per minute. If heart rate is greatly increased in tachycardia, generally what happens is the duration of the cardiac cycle decreases. More commonly, it affects the diastolic period of the cardiac cycle. So, the overall duration of the diastole decreases. If the duration of the diastole decreases, the filling capacity of the coronary artery decreases. So, if coronary arteries cannot receive blood from the aorta, it leaves the blood in the aorta itself. So, the left behind blood which is present in the aorta, which is not taken up by the coronary arteries, increases the volume in the aorta during diastole, so automatically increases in the pressure in the diastolic period of the cardiac cycle, responsible for the increase in the diastolic BP, right? So, increase in the heart rate, that leads to what happens? Decrease in the coronary artery filling, right? Decrease in the coronary artery filling. So, increase in the heart rate causes decrease in the diastolic period of the cardiac cycle. Decrease in the diastolic period of the cardiac cycle causes decrease in the coronary artery filling capacity. So, that causes more blood is present in the aorta during diastole, causes increase in the diastolic blood pressure. So, these are the three important factors which are responsible for increase in the diastolic blood pressure. So, what are the factors which are responsible for decrease in the diastolic BP over here? What are the factors which are responsible for decrease in the diastolic blood pressure? First is the vasodilation of the PVR arteriole. So, here let me write decrease in the diastolic blood pressure. What are the factors which are responsible for decrease in the diastolic blood pressure? First one is vasodilation, because exact opposite to the increase in the diastolic BP. Here vasoconstriction of peripheral arterioles, here is the vasodilation of peripheral vascular resistant arterioles, causes decrease in the diastolic BP. and severe anemia, because here whenever the blood viscosity is increased, diastolic BP increases. So in the same way, whenever the blood viscosity decreases, so remember that diastolic blood pressure decreases. Examples like severe anemia, and the best example is the sickle cell anemia. So increase in the heart rate is the one which increases diastolic BP, decrease in the heart rate increases the filling of the coronary arteries, leaving less blood in the aorta during diastole, right? So the third important factor is the decrease in the heart rate, exactly opposite to that of each other. These two are the factors which are responsible for increase as well as decrease in the diastolic blood pressure. So this is what is about the diastolic blood pressure.